Hello, everyone. Welcome to another great lesson with us here at English Pod. My name is Marco.
And I'm Erica.
And today we're going to be talking about an ER, an emergency room.
Exactly. We're bringing you our very own ER drama here at English Pod.
Yeah, doctor shows are very popular with people, medical terms and all that stuff.
Yeah, so we're going to teach you some words that you might hear commonly in medical shows on TV or in movies. This is really common language in television.
Or even at a hospital, right?
Well, yeah, but let's hope our listeners don't have to face this.
Okay, so let's preview some words in vocabulary preview.
Vocabulary preview.
All right, so what's our first word?
Okay, the first word is CPR.
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 So that's pretty easy. What does that mean?
Well, it's short for cardiopulmonary resuscitation.
Okay.
If that means anything to you.
Well, cardio is related to the heart.
Uh-huh.
Pulmonary refers to the lungs.
Yep.
Resuscitation means to come back to life.
Yes. So basically CPR is, when someone stops breathing, you put your mouth on their mouth and you breathe inside their lungs.
Okay, to give them air.
Yeah.
Oh, okay.
So CPR.
That's CPR. Okay. So let's take a look at our next word. BP.
BP.
So BP is short for
Blood pressure.
blood pressure. That's
Yeah.
just the way that doctors use it in the emergency room.
Exactly. Pretty simple.
Okay, so blood pressure. And our last word, acute respiratory failure.
Acute respiratory failure.
So what is that exactly? That sounds complicated.
Basically, it's really serious that you stop breathing.
You stop breathing.
Yeah.
Okay. So if you go into acute respiratory failure, then the doctor or somebody has to perform CPR.
Right.
All right, cool. Okay, so we've previewed these three great words. Now let's listen to our dialogue for the first time. It's going to be really fast and you're going to have a lot of drama in it, so don't worry if you don't understand everything.
Yeah, we're going to come back and teach you some of the important language.
Help! Are you a doctor? My poor little Frankie has just stopped breathing. Oh my gosh, help me. I tried to perform CPR, but I don't know if I could get any air into his lungs. Oh, Frankie!
Ellen, get him hooked up to a monitor. Somebody page Dr. Hauser. Get the patient to hold still. I can't get a pulse. Okay, he's on the monitor. His BP's falling. He's flatlining.
No! Frankie! Doctor, do something!
Someone get her out of here. Get me the defibrillator. Okay, clear? Again, clear? Come on, damn it, I'm not letting go of you. Clear! I got a pulse.
Okay, what's happening?
Patient is in acute respiratory failure. I think we're going to have to intubate.
All right, tubes in. Bag him. Somebody give him 10 cc's shot of adrenaline. Let's go. People, move, move.
Doctor, oh, thank God. How is he?
We've managed to stabilize Frankie, but he's not out of the woods yet. He's still in critical condition. We're moving him to intensive care, but...
Doctor, just do whatever it takes. I just want my little Frankie to be okay. I couldn't imagine life without my little hamster.
Wow, so much drama over a little hamster.
Yeah, a little pet, hey?
A little pet, the little hamster.
Well, you know what? I can relate to this owner, and I'm going to tell you a little bit more about that later.
Yeah, I know you have a really good story about this.
Yeah, but in the meantime, let's look at some great language in Language Takeaway.
Language takeaway.
All right, so let's take a look at our first word. Intubate.
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 So this is a medical procedure.
Exactly. When a patient can't breathe properly, sometimes the doctor takes a long tube and puts it into their mouth and down their pipes, I guess, down their breathing tube.
Right.
So that they can breathe better.
Okay, so that's to intubate.
Yes.
Okay, so once they've intubated the patient, they start to bag him.
Yeah, bag him.
Bag him.
Bag him.
Does that mean they like put a bag over the person's head or something?
No. So there's a bag attached to this intubation tube, and you squeeze it to put air into the lungs.
Okay, so you squeeze this bag and it puts air through the tube.
I think this is just medical slang.
Yeah, I guess backham.
But you hear it all the time on TV, so it's important our listeners know it.
Okay. Let's look at our next word. Critical condition.
Critical condition.
Critical condition.
The patient's in critical condition.
This condition means it's serious.
Right. If a patient is in critical condition, they're either really, really hurt or really, really sick, and they could die pretty soon.
Okay. So you don't want to be in critical condition.
No.
Let's take a look at our next word. Stabilize.
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 So when the doctors stabilize a patient, they take that patient out of danger.
Exactly. When a patient is stabilized, they probably won't die in 5 minutes.
Okay.
But they could still be really sick. They could be in critical condition, right?
But it's under control.
Exactly.
Okay.
Yeah.
Stabilize. Let's look at our last word. ICU.
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 Intensive care unit.
Okay, that's what it means. Intensive care unit.
Yep.
So that's the place where patients who are in critical condition are taken.
Right.
So what's the difference between an ICU and a regular room?
Well, I don't know. I've never been in one. But I think like patients are monitored regularly. And I think there's, maybe there are more nurses and fewer patients. There's just a higher level of care.
A higher level of care.
Yeah.
Okay, so it's time for us to listen to our dialogue again. Now try to catch all of these medical terms that we've just talked about, and then we'll come back and explain a few phrases.
Help! Are you a doctor? My poor little Frankie has just stopped breathing. Oh my gosh, help me. I tried to perform CPR, but I don't know if I could get any air into his lungs. Oh, Frankie.
Ellen, get him hooked up to a monitor. Somebody page Dr. Hauser. Get the patient to hold still. I can't get a pulse. Okay, he's on the monitor. His BP's falling. He's flatlining.
No! Frankie! Doctor, do something!
Someone get her out of here. Get me the defibrillator. Okay, clear? Again, clear? Come on, damn it, I'm not letting go of you. Clear! I've got a pulse.
Okay, what's happening?
The patient is in acute respiratory failure. I think we're going to have to intubate.
All right, tubes in, bag him. Somebody give him 10 cc's shot of adrenaline. Let's go, people, move, move.
Doctor, oh, thank God. How is he?
We've managed to stabilize Frankie, but he's not out of the woods yet. He's still in critical condition. We're moving him to intensive care, but...
Doctor, just do whatever it takes. I just want my little Frankie to be okay. I couldn't imagine life without my little hamster.
Okay, so there are some really good phrasal verbs in this dialogue.
Yeah, a couple of good phrasal verbs.
Okay, so let's take a look at these phrasal verbs in putting it together.
Putting it together.
All right, so what's our first phrasal verb today?
Hook up.
Hook up.
Hook up.
So to hook up.
So when we talk about hooking something up, we are usually talking about electronics, right, Marco?
Yeah, you usually hook up your TV or your computer.
Yeah.
So why don't we listen to some examples of how we would use hook up?
Example 1.
I finally got a Nintendo Wii. Come on, help me hook it up to the TV.
Example 2. I don't know how to hook up this new DVD player. Can you help me? Example 3.
I just hooked up my new HD TV. Want to come over and watch a movie?
Great. So you can see that there are a few different variations of this pattern here with the word hook up because it's a phrasal verb.
Exactly.
And I think the same patterns can apply to our next phrasal verb.
Hold still.
Hold still.
Hold still.
Hold still.
So the doctor needed the patient to hold still.
Right. To stop moving.
Stop moving. Exactly. Okay, let's listen to some more examples of hold still because, again, it's a really great phrasal verb that you can change up a little bit.
Example 1. If you don't hold still, I can't see if you have something in your eye.
Example 2.
Hold still while she cuts your hair, or else she might make a mistake.
Example 3.
Hold still, you have a bee on your back.
Okay, hold still. Great word.
Yep. All right, one final phrase for you. Out of the woods.
Out of the woods.
Out of the woods.
Out of the woods.
So when someone's out of the woods, they're
Free from danger.
safe.
Okay, safe.
Yeah.
I guess it's kind of a saying.
Yeah.
Like, I'm out of the woods.
Yeah.
I'm
Yeah.
free. I'm safe.
I guess there are two variants of this phrase. We can say, I'm out of the woods, or we're out of the woods, or I guess we're not out of the woods yet.
Uh-huh.
Yep.
So, okay. Out of the woods. Okay, so now it's time for us to listen to our dialogue again. And when we come back, Eric is going to tell us about her ER story.
Help! Are you a doctor? My poor little Frankie has just stopped breathing. Oh my gosh, help me. I tried to perform CPR, but I don't know if I could get any air into his lungs. Oh, Frankie.
Ellen, get him hooked up to a monitor. Somebody page Dr. Hauser. Get the patient to hold still. I can't get a pulse. Okay, he's on the monitor. His BP's falling. He's flatlining.
No! Frankie! Doctor, do something!
Someone get her out of here. Get me the defibrillator. Okay, clear? Again, clear? Come on, damn it, I'm not letting go of you. Clear! I got a pulse.
Okay, what's happening?
Patient is in acute respiratory failure. I think we're going to have to intubate.
All right, tubes in, bag him. Somebody give him 10 cc's shot of adrenaline. Let's go, people, move, move!
Doctor, oh, thank God. How is he?
We've managed to stabilize Frankie, but he's not out of the woods yet. He's still in critical condition. We're moving him to intensive care, but...
Doctor, just do whatever it takes. I just want my little Frankie to be okay. I couldn't imagine life without my little hamster.
Okay, Erica, so what happened? What emergency did you have?
Well, it was with my cat.
Your cat.
Yes, I had some people over for dinner, and it was maybe 1:30 in the morning, and I went downstairs to let them out and show them where the taxis were. And then I came up and I saw that the cat was gone, and it turned out that the cat fell out of the window.
Fell out of the window.
Yeah.
All right, but our listeners have to know, what story or what floor do you live on?
The 20th floor.
The 20th.
Yeah, so this is really dangerous, right?
That's really high up.
Yeah. So I went outside and I was calling for my cat, and I was like, Mr. Finn, where are you?
How did you know he fell out?
I just knew.
Yeah?
Yeah.
Mother's instinct.
I guess so. And so he was calling back to me, and so I picked him up and brought him to the house, and then we had to bring him to the vet, and it was 2:30, 3 in the morning at this time, and the vet was like not very happy that we woke him up out of bed.
But that was a really good emergency, though.
Yeah. So anyway, we brought him to the vet. He was in critical condition for a couple of days, and then we had to keep him in the vet's ICU for about a week. He broke his back. He broke two of his legs.
Wow.
Yeah, and so he was in the hospital for 3 weeks, and then at home on bed rest for another 3 weeks.
Wow.
But now he's good as new.
Good as new.
Yeah.
He used up one of his 7 lives.
Yes.
9 lives.
Nine. Yeah. I think maybe 8 of his 9
8.
lives.
He's only got 1 left.
Yeah.
Wow, that's an interesting story. I guess that's the inspiration under this dialogue.
Exactly. Sometimes we Anglos really treat our cats and our hamsters and our dogs like they're our children.
Yeah. Well, no, that's good.
Yeah.
Well, I'm glad Mr. Finn is okay and he's walking and good as new.
Yep, good as new.
So maybe our users have some stories about their pets
Yes.
being taken to the hospital.
I want to hear.
The emergency room is one of the most challenging hospital departments. Here, patients often need immediate medical attention in critical conditions, while medical staff must make quick, accurate decisions under time pressure. Since the ER frequently deals with life or death situations, medical terminology and rapid, effective communication become particularly crucial in this environment. For non-medical professionals, ER terminology often seems unfamiliar and complex. While we encounter medical terms daily, their usage becomes more technical and time-sensitive in real emergency situations. Therefore, mastering these basic emergency terms is extremely useful for medical students, non-specialist professionals, and the general public alike. This section will explain common ER terms including cardiopulmonary resuscitation (CPR), blood pressure (BP), and acute respiratory failure, helping readers grasp what these terms mean and how they're used in practice. Cardiopulmonary resuscitation (CPR), a life-saving emergency technique. CPR is used when someone stops breathing or their heart stops. This technique keeps oxygen flowing to the brain and vital organs, buying time until more advanced help arrives. CPR basics. This emergency technique is meant to restart a patient's heartbeat and breathing using hands-on methods. It involves 2 key steps. Chest compressions, pressing on the chest to mimic the heart's pumping action and maintain blood circulation. Rescue breathing, giving oxygen via mouth-to-mouth or other means to restore breathing. In the ER, CPR is often performed on patients with cardiac or respiratory arrest. When the heart stops, blood can't reach the brain, starving brain cells of oxygen. Quick CPR can prevent brain damage while awaiting further treatment. Why CPR matters. Performing CPR right away is crucial to saving lives. Research shows that without CPR within 4 to 6 minutes of cardiac arrest, the patient's brain can be permanently damaged. So knowing CPR isn't just vital for our staff. Everyone should learn this basic first aid. In emergencies, medical teams rapidly assess patients, decide if CPR is needed, and start CPR following standard procedures. ER applications. A patient goes into cardiac arrest after a severe crash, and ER doctors jump straight to CPR. A nurse spots respiratory arrest and recovery, and starts CPR immediately. For electric shock or drowning victims, immediate CPR is crucial to bringing them back. In these critical moments, CPR isn't just vital. It often means the difference between life and death. That's why our teams need to know CPR inside out and act fast when the pressure's on. Blood pressure (BP), a key indicator for monitoring vital signs. Blood pressure (BP) refers to the pressure exerted by circulating blood against the walls of blood vessels. It serves as a critical measure of heart health and circulatory system function. In emergency settings, changes in blood pressure often signal whether a patient is in critical condition. Definition and measurement of BP. Blood pressure is typically measured using a sphygmomanometer, blood pressure cuff, and consists of 2 primary values. Systolic pressure, the maximum pressure generated when the heart contracts and pumps blood into the arteries. The ideal systolic pressure is generally around 120 mmHg. Diastolic pressure, the lowest pressure in the arteries when the heart relaxes and fills with blood. The ideal diastolic pressure is around 80 mmHg. Clinical significance of blood pressure. Normal blood pressure. Systolic pressure below 120 mm of mercury and diastolic pressure below 80 mmHg. Hypertension. Consistently high systolic pressure above 130 mm of mercury or diastolic pressure above 80 mmHg. Hypertension increases the risk of heart disease, stroke, and kidney disease. Hypotension. Systolic pressure below 90 mm of mercury or diastolic pressure below 60 mm of mercury, which may cause dizziness, fainting, or even life-threatening conditions. In the emergency room, doctors and nurses routinely monitor a patient's blood pressure to assess circulatory status. A sudden drop may indicate severe bleeding, shock, or heart failure, while a spike could signal a hypertensive crisis or other cardiovascular issues. Applications in the emergency room. Scenario 1. A patient with severe bleeding leading to low blood pressure requires immediate fluid infusion or blood replacement therapy. Scenario 2. A patient experiencing a hypertensive episode with severe headaches requires quick evaluation and treatment adjustment by emergency doctors. Scenario 3. For a patient suffering an acute heart attack, Rapid changes in blood pressure demand adjusted treatment approaches based on BP readings. O. Acute respiratory failure, ARF, emergency treatment and care. Acute respiratory failure, ARF, occurs when the lungs fail to supply enough oxygen to the blood or cannot effectively eliminate carbon dioxide, leading to low oxygen levels and carbon dioxide buildup. It is one of the most severe conditions in the ER, often requiring immediate medical intervention. O. Types of acute respiratory failure. Type 1. Hypoxemic respiratory failure characterized by inadequate oxygen supply, with significantly low blood oxygen levels. Type 2 hypercapnic respiratory failure characterized by carbon dioxide buildup, where elevated CO2 levels may lead to respiratory arrest. O. Common causes of ARF. Chronic conditions, like chronic obstructive pulmonary disease, COPD, or asthma. Acute conditions, like acute pneumonia, heart failure, or pneumothorax. External factors, such as drug overdose, suffocation, or trauma. O. Emergency room management. Treatment for acute respiratory failure typically includes oxygen therapy, providing extra oxygen through masks or nasal cannulas. Mechanical ventilation. When oxygen therapy isn't enough, mechanical ventilation or intubation may be needed to assist breathing. Medication treatment. Drugs like bronchodilators or antibiotics may be used to treat the underlying cause of respiratory failure. O. In practice. In the emergency room, when a patient has acute respiratory failure, doctors must immediately determine whether emergency intubation or other treatments are needed based on oxygen levels, carbon dioxide levels, and other vital signs. Patients may require repeated oxygen therapy or ventilator support throughout their treatment. Common scenarios in the ER. Understanding and applying medical terms. The ER environment is typically highly stressful and full of unknowns. In these situations, quick and precise use of medical terms is critical. Doctors, nurses, and other first responders must be able to rapidly assess a patient's condition and make the best decisions in the shortest time possible. In this high-pressure setting, accurate medical vocabulary helps medical staff communicate effectively with patients and families while improving treatment efficiency. O. Many emergency medicine terms, though rarely used in daily life, can make the difference between life and death. Let's look at several common ER scenarios to examine how these terms are applied, with communication tips to help everyone communicate quickly during emergencies. O. Scenario 1. Cardiac arrest and CPR. In the ER, cardiac arrest is one of the most common and urgent situations. When someone goes into cardiac arrest, their heart suddenly stops beating, cutting off blood flow to all organs, especially the brain. Without immediate restoration of heartbeat, the patient may die within minutes. O. Important terms to know. CPR, cardiopulmonary resuscitation. When cardiac arrest occurs, CPR is the key to saving lives. ER staff immediately begin CPR, including chest compressions and rescue breathing. BP, blood pressure during cardiac arrest. Constantly monitoring blood pressure is crucial. A steadily dropping BP may mean the patient's circulatory system is failing, requiring more aggressive treatment. O. Communication techniques. Talking to family members. During cardiac arrest, family members are often extremely panicked. Right now, doctors need to explain the situation calmly and concisely while informing them of the emergency treatments we're doing. For example, a doctor might say, "We're currently performing CPR and closely monitoring the patient's blood pressure. We're doing everything possible to save them." Team coordination. Communication within the medical team is critical. Emergency physicians, nurses, and technicians must quickly delegate tasks, such as nurse monitor the blood pressure, or technician prepare the defibrillator, making sure everything's done quickly and correctly. Scenario 2. Treating acute respiratory failure. Acute respiratory failure is a life-threatening condition typically caused by sudden lung/respiratory failure, leading to insufficient oxygen supply. Patients may exhibit severe respiratory distress, signs of hypoxia, or even loss of consciousness. In an emergency setting, acute respiratory failure requires emergency treatment, as it can be fatal. Medical terms. Acute respiratory failure. When a patient's respiratory system fails to provide adequate oxygen, doctors use acute respiratory failure to describe the condition. In such cases, the patient may require mechanical ventilation to maintain breathing. Intubate. If the patient's respiratory function doesn't recover, doctors may need to intubate to support breathing. Intubation is a common emergency procedure aimed at ensuring sufficient oxygen supply. Communication techniques. Here's the improved translation incorporating the expert suggestions. Communicating with the patient. If the patient is conscious and able to communicate, the doctor should explain clearly and simply. We'll insert a breathing tube to help you breathe better. Throughout the process, the doctor must ensure the patient understands why this is needed and provide comfort. Teamwork during intubation. During the procedure, the team must coordinate closely. Nurses prepare the equipment while respiratory technicians handle the intubation. The doctor directs the team and keeps checking the patient's oxygen levels and vital signs. Scenario 3: Blood pressure monitoring and crisis management in the ER. Blood pressure is a key measure of heart and vascular health. In the ER, medical staff decide if more treatment is needed based on blood pressure changes. For example, acute hypertensive crisis or severe low blood pressure may point to serious health problems like bleeding, heart failure, or stroke. Key terms. Blood pressure. BPER teams need to constantly check blood pressure to adjust treatment quickly. Sudden changes may signal worsening conditions, especially in trauma or heart-related cases. Stabilize. For critically low blood pressure, doctors work to stabilize it with 4 fluids or medications, keeping vitals normal. Communicating with families. In severe high or low blood pressure cases, families often panic. The doctor should explain, "We're stabilizing the blood pressure with fluids and medication. Don't worry, we're keeping close watch." Internal team communication. When an emergency doctor notices a sharp drop in a patient's blood pressure, they'll immediately direct the nurse to start N4 and get medications ready. "Nurse, get me D5 stat and start fluids." The doctor will keep monitoring the patient's BP and adjust treatment as needed. Emergency room culture. The importance of efficient communication in emergencies. The emergency room, ER, is one of the most challenging environments in a hospital. Here, doctors and nurses often face critical emergencies where a patient's condition can deteriorate rapidly and even become life-threatening. In such moments, quick and precise communication not only helps the medical team make timely decisions, but also ensures patients receive the best possible treatment. In this setting, medical terminology and efficient communication are essential. Effective communication among the medical team ensures smooth coordination throughout, from patient admission to the entire emergency treatment process, all requiring precision. In this context, medical terminology serves as the foundation for efficient communication. However, in the high-pressure ER environment, using this terminology correctly to prevent misunderstandings, as well as communicating effectively with patients and their families during busy shifts, are key concerns in emergency medicine. Cultural differences and language barriers. Challenges in cross-cultural medical communication. With globalization, patient populations in the ER have become increasingly diverse, and staff may come from varied cultural backgrounds. In such a multicultural setting, language and cultural differences can create major communication challenges, impacting care quality. In some cultures, patients and their families may rely more on nonverbal communication, like eye contact or body language, to express concerns or dissatisfaction with treatment. In others, patients might hesitate to ask doctors questions directly due to cultural norms or reluctance to voice doubts about treatment plans. These cultural differences can lead to misunderstandings between doctors and patients, affecting diagnosis and treatment accuracy. Language barriers in the ER. ERs frequently handle life or death situations, and language barriers can make doctor-patient tensions worse. When treating patients who don't speak the local language, doctors may struggle to convey information accurately. Especially in emergencies where medical teams need to act fast, language barriers can slow down critical treatment decisions. For example, if a non-English speaking patient requires urgent care but can't clearly describe their symptoms or medical history, doctors may struggle to diagnose accurately. In these cases, hospitals typically use professional medical interpreters or translation devices to assist communication. But translation help isn't always perfect, particularly in emergency situations requiring immediate medical decisions. Beating communication barriers, language and cultural adaptation in the ER. Though the ER never slows down, healthcare providers can use specific strategies to overcome these communication challenges and work more effectively. Here are key techniques to help medical teams interact better with patients and families in emergency settings. 1. Keep it simple. Use clear language. In the ER, healthcare providers should avoid complex medical jargon, especially with patients or families. While these terms are necessary clinically, explanation should be straightforward. For instance, instead of acute respiratory failure, say in plain terms, your lungs are temporarily unable to absorb enough oxygen. Simplified language helps families understand and reduces anxiety. 2. Respect cultural differences and practices. Here's the improved translation incorporating the expert suggestions. In a multicultural emergency room setting, respecting patients' cultural backgrounds is crucial. For instance, in some cultures, family members may be more inclined to participate in medical decision-making, while in others, patients may prefer to make independent decisions. Doctors must be attuned to the cultural needs of patients and their families and use appropriate communication methods. For example, when dealing with a patient from a more conservative cultural background, physicians should be more careful, respecting their personal privacy and decision-making rights. 3. The use of nonverbal communication. Beyond verbal communication, nonverbal cues, such as eye contact and gestures, are vitally important in the ER. Particularly in multilingual environments, doctors and nurses can show they care and reassure patients through nonverbal means. For instance, a physician might give a reassuring pat on the shoulder or use eye contact and body language to express understanding and support. Nonverbal communication helps alleviate tension in patients and their families, helping build trust. 4. Using modern technology to aid communication. With technological advancements, the healthcare industry has increasingly adopted tools to enhance communication efficiency. In the ER, doctors and nurses can use electronic medical records, mobile translation apps, and voice recognition technology to overcome language barriers. Especially in emergencies, translation apps can quickly convert medical instructions or patient needs into different languages, cutting down on delays caused by language obstacles. 5. Training and improving cultural understanding. Hospitals should provide regular multicultural training for emergency staff to help them understand communication styles and medical practices across different cultural contexts. Through such training, healthcare workers can better understand patients' needs and use the right approach to communicate. Additionally, hospitals should encourage staff to be more aware of cross-cultural communication and develop sensitivity to cultural differences, ensuring misunderstandings don't arise during treatment due to cultural disparities. By continually improving cross-cultural communication skills, ER healthcare teams can maintain good communication with patients in high-pressure situations while providing more compassionate, professional care. This helps medical teams manage patients from all backgrounds and ensures fast, accurate treatment when it matters most. ER communication is a complex process with many layers, involving medical terminology, crisis response skills, and cross-cultural understanding. Mastering common emergency medical terms and using good communication skills are key for ER staff to make quick decisions and ensure quality care when treating life-threatening cases. At the same time as healthcare becomes more global, cross-cultural communication has become a major challenge in emergency medicine. By improving language skills and cultural adaptability, ER staff can handle all kinds of emergencies in high-pressure situations, working more efficiently to keep patients safe and alive. Thanks for tuning in. We hope you enjoyed this episode and gained some new insights. Don't forget to subscribe so you won't miss any future episodes. See you next time.